Hello and welcome to this webinar on house dust mite. Today we've got a good lineup of speakers for you, and the webinar's aimed at people with an interest or those that might be affected by house dust mite allergy. And I do hope that you find it very interesting and very informative, and that you think about what questions you might like to ask, and you will have opportunities to ask those questions at the end of the presentation and create that dialogue with our experts. Thank you very much for joining us today. I'm going to tell you a tiny bit about Allergy UK, and we are a patient information and support and advice service, and we cover all aspects of allergic disease, whether it's drug allergy, food allergy, venom allergy, allergic rhinitis, allergic eye disease. We cover all that. So it's quite a huge remit. Our vision currently is no one should die of allergy, and our mission is for everyone in the UK to take allergy seriously. Our goals are to empower, educate, research and influence. However, we are starting the move for next year to launch our new strategy going forward, and we will be launching our new vision and mission. And you found your way to Allergy UK, so you'll probably know that people need us to provide the quality of support and advice and information, and raise awareness on your behalf of the condition and how it impacts on everyday life. And we advocate to ministers and in Parliament on behalf of the allergic community. So some of our services you might have come across are translation cards for people who go on a holiday or in different languages, and with all the allergens written on, are very popular. We've got an allergy house that you might like to visit, and it tells you, it's an interactive online tool, if you like, a house where in the different rooms it identifies different hotspots for indoor allergens. So there's one in the house dust mite, and you can learn lots more about it with our fact sheets, etc. We've got a helpline which is a very busy helpline, but is always there for people to ask questions, or if they want further advice or they can't find the information on our website. And we have services as well. So we have a dietitian service, we have an eczema service, and we try and be as helpful as what we possibly can to people with allergy. So the last bit is just to tell you about the questions. So any questions you may have, so when we go through all the presentation slides and you might have a question and you want to contribute to the live question and answer session, then the questions can be posted using Slido on our webpage or via the Slido app, and it's hashtag AUK28 AUG, and that's all uppercase, that's all capitals. So sit back, and I hope you enjoy this house dust mite webinar. So the first part of this webinar, I want to actually tell you what a house dust mite is. You might find this very interesting. Many of you might know something about house dust mites, but I'm hoping that I'll be able to let you know some things that perhaps you didn't know before. So a house dust mite, this is what it looks like. It looks quite awful, doesn't it? But they're microscopic. They are so tiny you can't see them with the human eye. And so you won't see a house dust mite, But we know if we look down a microscope that they are there, and they are in everybody's houses. And they make their homes in places where dead skin cells are more likely to build up. And that's usually within bedding and carpets and furniture. All those places that feel very, very cozy are sometimes where you'll find house dust mites in their numbers. So first, it's a good idea to see what an actual house dust mite is, because then people start taking it a tiny bit more seriously that they exist. Because you can't see them, it's sometimes difficult to think that these house dust mites do exist. Now, as you can see on the screen in front of you is a short video showing these house dust mites. You'll see tiny little baby ones and bigger ones. Now, don't forget that this is looking down a microscope. So you wouldn't be able to see any of this, all this activity going on with the house dust mites in the carpets or the curtains or the bedding or any of your soft furnishing, because they are so tiny. But it's important to take them seriously because they do exist. So just important to know, because whenever I watch a video like that, I start itching a tiny bit. But it's important to know that house dust mites do not live on humans. So they're not the same as bed bugs, so don't worry about that. They do not live on humans. But their preferred food source is shed skin flakes. So areas such as the bed will have higher populations of the house dust mite because I want to feed on that. But remember, you can't see them, so you would never know that they're there. So they're what they call hygroscopic, which means that they absorb water from the air through their bodies. So they don't drink water in the way that we drink water. They absorb them in through their bodies. So they love humid environments, and preferably when humidity levels are above 50%. And that's often, in a house where you might be drying, washing, you might be doing lots of cooking, you might have lots of showers or baths. All that actually adds water and moisture into the atmosphere, into the indoor house, and that raises the humidity levels. And that's exactly what house dust mites like. So you'll be hearing a bit about how you can reduce all that. So they love warm conditions, but it's important to know they're killed at temperatures above 55 degrees. So if you put your bedding on a 60-degree wash, it will kill the house dust mite. But their average life cycle of a mite is between 65 and 100 days, which isn't that long, but it's long enough. And a mated female house dust mite can live up to 70 days, laying a huge amount of eggs. So in a 10-week lifespan, each house dust mite will produce approximately 2,000 fecal particles. And let's not forget, it's the fecal particles. So the other word for that would be poo. So when a house dust mite poos, then that's called fecal particles, and that is what becomes airborne, and that's what causes the allergy. So with the coughing and the sneezing and the itchy eyes and things. So it's important to know all those things. But above 60 degrees, washing the bedding will kill the house dust mite. So dust mites are found around the world. They're not to be confused with bed bugs, as they're very different types of creatures. They don't bite, and so you don't have to worry about them living on you and biting you because they're not bed bugs. The two types of species that we get is a European house dust mite and American house dust mite, although the European one is more prevalent over here. Got very, very big long names, so we abbreviate that to DPT and DF. And so when you go into hospitals to be tested, sometimes they might do it by skin prick test, and you'll hear all about that when our doctors talk to you. But they parts of the house dust mite, the allergen components, that's what they might test for in some respects, especially if somebody might be doing a treatment called immunotherapy. And you'll hear all about that, and that's really important to know. So although the house dust mite feed on skin flakes from humans and animals, sometimes you can find that this D. farini, this DF, can also feed on some molds which are commonly found in the homes. So it's been 50 years since the house dust mite was first appreciated to be a major source of allergen in house dust and is a key trigger of allergic respiratory disease. And you'll hear lots more in depth about that from our doctors. And so they'll talk to you about what this word IgE-mediated hypersensitivity is. But it's an allergic reaction to the proteins in the fecal waste, the poo of the house dust mite. Sounds horrible, doesn't it? But that's what we react to. We don't react to the house dust mites themselves. It's the poo that is very lightweight that becomes airborne, and that's what can get into the respiratory system and trigger asthma and allergic rhinitis. So very little mite allergen stays airborne in a house for more than 10 to 20 minutes. And airway inflammation results from ongoing exposure to relatively large particles. And that's why when we hear from one of the speakers who's got a lived experience viewpoint, that will also tell you about how to reduce your exposure. If you do some of these types of things, hopefully that will start reducing these relatively large particles. And things like washing the bedding at 60 degrees kills the house dust mite, so you don't get all that build-up of house dust mites. So house dust mite allergy lacks a clear-cut seasonality. So that means it's not like hay fever that just happens in usually between April and July. So it's considered all year round. So we call that a perennial allergen. So it can give you symptoms all year round. And they don't actually have, some people don't have any respite of their symptoms at all. But we do know that people can become much worse in the autumn and winter months when the heating goes on. And our doctors will talk about some of that, because the temperature, the rise in temperature and the humidity and any lack of ventilation, so if you don't open the windows, etc., to let all the clean air come in, all that contributes to that indoor environment that the house dust mites love. And you'll hear lots more about the effects of house dust mite and what you can do about it as well. And don't forget, everyone's house has house dust mite. It's just how much house dust mite we have and how we reduce it. Thank you very much for listening. And now I'll hand over to our expert speakers, and hopefully you'll learn lots more interesting things about house dust mite and house dust mite allergy.
Hi everybody, welcome to this talk. Thank you for coming along. My name is Dr. Helen Evans-Howes, and I'm a GP who has specialised in allergies. And I've been asked to talk about the sort of signs of house dust mite allergy and when you should be looking to seek help. So just a little bit about me. So I am a GP, although I have to say I don't do very much GP work anymore because my time is kept very busy running my own allergy clinic, Dr. Helen Allergy, seeing children and adults with allergies. And I've been working in the field of allergy for about 10 years or so. And the reason that I became interested is because my elder son, Ethan, who's 16 now, had milk and nut allergies. And I started a journey of realising I knew very little about allergy. So I went back to university, did a master's in allergy, and found something that I'm incredibly passionate about. And I have 3 biological children. And whilst Ethan has lost his food allergies, thankfully, he still has environmental allergies to house dust mite and cats and asthma. And then my middle daughter, Florence, has environmental allergies and eczema. And my littlest one, Gigi, has some eczema as well. And I also have house dust mite and hay fever. So I really do understand how it feels and how much it can impact your day-to-day life. I've been the primary care chair for the British Society of Allergy, and I am a trustee for Anaphylaxis UK. So I'm sponsored by lots of different people, essentially, to basically give up my time to teach, mainly healthcare, so that we can upskill GPs to make sure that they know how to look after you better. But also I do a lot of work with patients and families, trying to empower you to have the knowledge to understand your own health conditions, what to ask for in appointments, and to know what's out there, because sometimes I think people don't even realise that there are treatment options available for both environmental allergies and food allergies. And without knowing that, we can't push the system forward to hopefully mean that these things will be offered more and more. So I just thought I'd just give you a brief overview of some of the medical terms that you might hear in the upcoming talks, so that you know what we're talking about. So rhinitis just means inflammation of the lining of the inside of the nose, and generally that will cause symptoms like sneezing, runny nose, or congestion, that feeling of being blocked. And you can actually have allergic rhinitis, which is what we're going to be talking about today, and non-allergic rhinitis. Those might occur for lots of reasons, such as hormonal changes, so in pregnancy, for instance, from infection. It's quite common for older people to get a runny nose. Some medicines cause it. And so it's really important when we as specialists see you with your symptoms that we actually try and work out, is this definitely allergic in cause? Because it might affect the treatments that we offer you. Rhinoconjunctivitis just basically is when it involves the eyes as well. So you'll get itchy, runny eyes that sometimes can be quite sticky. So that classic conjunctivitis appearance, but often with the nose symptoms as well, which will lead us to think it's allergy. And perennial just refers to all round, all year round symptoms. So that really is often the case with house dust mite. Whereas seasonal, if you've got hay fever, might occur just in the spring or the summer months. And some people have occupational, where there's something that they're allergic to in the work environment. So an allergen is obviously something that you're allergic to. And it is quite sort of straightforward in the UK, really, and that quite often I can work out just from what somebody is telling me and the times of year that they have the symptoms. I can often work out what someone's allergic to. But testing can be important to do to make sure that somebody has got their allergy confirmed. But we don't always do that in a GP practice environment, because sometimes it is blatantly obvious that you're coming in the summer months, it's hay fever symptoms, and it goes away the rest of the year. But for me, if people are presenting for the first time in, say, their 60s, 70s with allergic symptoms when they've never had that before, or particularly if like maybe the main feature is eyes and no symptoms at all, or even sometimes the other way around, then I might think, I wonder if this is definitely allergic driven. And so we might then test to sort of almost prove it isn't, so that we can make sure that we don't miss another cause. So testing can be helpful to confirm that we are definitely barking at the right tree, so to speak. But house dust mites, you can't get away from them in the UK. They love our climate, and so we are affected by them all year round. And so one of the questions I will often ask people is, have you been on holiday somewhere hot in the last year? And if they say yes, I often then say, and how were your symptoms? And it's amazing the number of people that will say when they have house dust allergy, I was so good when I was in Dubai, for instance, and I'm already like thinking, sounds like house dust mite. And to give you an example, we've just been to Turkey. It was 45 degrees, very hot. And Ethan said to me, I don't have any asthma here. And I was like, no. And have you noticed that you don't sneeze? You have no congestion here? And he was like, oh, no. And I was like, because there are no house dust mite. That's why you're much better. And that's why your asthma is much better controlled. So that for me is a really classical bit to the story. Tree pollen tends to occur in sort of April, May. Then if you have symptoms going on into May, June, July, you're more likely grass pollen. And if you have symptoms into August, then probably weeds are affecting you. And we have that more and more in the UK with the climate changes that we're seeing and the warmer weather. We are seeing more people presenting with weed allergies than perhaps we used to. Into the autumn months, you might find that molds affect you. And the other thing that might affect you all year round if you live with animals is the animals. We have cats and dogs, despite Florence being allergic to them. But it's pretty obvious because she will be licked by the dog and get a rash. Or somebody might say they know that if they go to their friend's house that's got a cat, then their symptoms will be triggered. And then if it's occupational, you might tell me a story that you have symptoms really badly when you're in the work environment, but if you have a break from work, again, your symptoms may get better. So yeah, we can often tell quite a lot from the history itself, which is why you may find that GPs don't always organise allergy testing for you, even though it's something they absolutely can do. And it is quite straightforward to do because they just ask for an environmental panel, and that will allow them to check house dust mite, grass pollen, birch pollen, which is the tree, mugwort, the weed, cat, dog, and molds are on there as well. So it gives them a nice overview if they just ask for the environmental panel on allergy tests. It is a condition which is incredibly common. So about 1 in 4 adults, about 25% of people will have environmental allergies, and about 10 to 15% of children. So when I was trying to ask ChatGPT to help me work out the numbers that involved based on the population of the UK at the moment, it's around 14 to 15 million people in the UK, which is absolutely staggering. And I think even more frustrating to my part when it's a condition which is downplayed so much, with very few resources of the NHS put into managing allergies or offering more permanent solutions such as immunotherapy, which you'll hear about. It really, really frustrates me because allergic disease is a spectrum where some people will just get mild symptoms like some sneezing or itch, and they either don't need to treat it or the odd antihistamine will benefit them. But on the severe end of the spectrum, you've got people whose quality of life is really affected, maybe poorly controlled asthma, significant fatigue, and there are options that are available for them. Was really thrilled to see that NICE, so the National Institute for Clinical Excellence, did approve recently treatments for not only house dust mite with Acarizax, but also for tree pollen, and we suspect that maybe grass pollen will come next, meaning that they are recognising the impact that allergies are having on people, and I was part of that discussion group. What we really need to see now is that those treatments are offered to more people and the access to it is much better. So the classic presentation, I think you all know this if you're listening today, would be sneezing, an itchy nose, itchy eyes, runny nose discharge that tends to be clear, congestion for some, and the symptoms will always be both-sided, so bilateral, and it usually occurs quite quickly after you've been exposed to that allergen, so the thing that you're allergic to, in this instance, house dust mite. You may find that you get one side more affected than another. So for instance, when I get grass pollen, I can tell you it's always this eye which swells up all the time, but the other one is still affected. I still have symptoms, but I just seem to be particularly struggling with one side. And there is a reason why you find that with the nose. You will find that through periods of the day, one nostril is more open than another because there's a natural cycle to breathing where one side opens more than the other. So at different points in the day, if you sort of breathe through your nose, like, you'll always find that one is more open than the other. But as you start to get more swelling within the nose, if you get more severe symptoms, you will just feel that it's constantly blocked. And of course, your eyes will be involved. And it's really easy to look up the nose. And I encourage doctors to do this for you. But actually, to be honest, you could do this on each other at home. If you just tipped up the end of the nose and got your light from your phone and had a little look up, it's surprising what you can see. So within the nose, we have these structures called turbinates. And we have an inferior, which is the bottom one, the middle one, and a superior one. And their function is to warm the nose, to humidify and filter the air that we breathe. But when they get inflamed, then they will obviously block the air coming in, and that's when people have this congestion. So if you look at the bottom middle picture, you can see an inflamed turbinate that's grown in size. So often when you look up, you will see that turbinate hitting the midline, so the septum of your nose, when really there should be a gap. And for some people, when they get environmental allergies, they will also get polyps, which look a bit grey. Polyps in children, we do need that referred on to make sure that there's not another underlying cause like cystic fibrosis. but it's not unusual for adults to have polyps from their allergic disease, along with the swelling within the nose, if you can see that. And when you look up your child's or your nose, or if someone takes a picture for you and you see that that's the swelling, it's no wonder you can't breathe and people are opening their mouths to breathe through it. So it's not a nice, simple thing that doctors can do to have a direct look at what's going on up there. So I thought I'd break down into the symptoms that people experience at different age groups, because there is a pattern where, you know, lots of people will have the sneezing, the itching, the itchy, runny eyes, but there are also some additional features that you'll notice more depending on the age of the person. Environmental allergies, when they're really affecting people, are very visual. And I can often go on the school run and spot the children, for instance, who have hay fever, because I know what they look like normally day to day. And then during the spring and the summer months, you will see a real change to their facial appearance, or the children or the adults coming in to see me, and they get these really dark rings under their eyes that look like allergic shiners. And that's what they're called. And if you are a sufferer of that, you'll know that people will constantly ask you, oh, did you not get much sleep? Are you quite tired? Whereas you're thinking, well, it's the same sleep I've always had, but it gives you this really dark ringed appearance around your eyes. And sometimes from itching your nose and that pushing up mechanism, people will get a little line, a crease across the top of their nose, which is known as the allergic salute, because you are itching your nose all the time. So children get that quite a lot. And sometimes people come in to see me in clinic because they want, say, treatment for that child's food allergies. And I'm looking at them going, oh, my goodness, the thing that we really should treat here is your child's environmental allergies, which is impacting them right now. So although food allergies are hard to live with, the impact of really difficult environmental allergies will be in the way that they're looking, the way they're breathing. They can't sleep very well. That affects their behavior. For some people, it actually does affect their eczema. And we know from some studies that actually if we can treat those environmental allergies really early in life, we perhaps might prevent them from going on to get asthma, which we know is really important in general day-to-day living, but also in the impact of controlling food allergies. So for me, controlling environmental allergies is such a crucial part to allergic management that I think is often overlooked. So little ones, when they're really struggling, as I've said, if those turbinates are really enlarged and swollen, they get congested, they'll breathe through their nose. Florence often can't close her mouth easily when she's eating because she can't breathe through her nose. They will snore. For some of them, they may get apnea, so those periods overnight where you seem to stop breathing. And if you are struggling with those environmental allergies, then it will affect the quality of sleep you're getting. And of course, when we see that in children, we will see that their behaviour changes and they get really fatigued. For some people, the inflammation then they're getting in their nose, rather than it running forward, particularly if they've got a lot of swelling, it will go backwards. And of course, the back of your nose connects into your throat. And so what happens is they start spitting up mucus or swallowing it. People do a noise to try and itch their throat, so or they'll cough quite a lot. And I know that Littleys, parents and colleagues will often say, oh, I think this 2-year-old's perhaps got asthma. And I'm thinking, well, not impossible, but it really is quite young for them to have asthma. And commonly what the problem is that they've got house dust mite allergy that is not well controlled. And that's why they're getting the coughing at night. And this is exactly how my son Ethan presented, was mislabeled as asthma. He did go on to get asthma, but actually the primary problem in the beginning was the house dust mite allergy and the cat allergy he had or has that was causing these symptoms for him. And for some, we know that they get more respiratory infections, more ear infections, glue ear. That will obviously affect their hearing. So I think house dust mite allergies has such a significant impact on some that people don't realise, because they just think of it as being a bit like mild hay fever. And so, you know, you'll just get told just to get on with it. Just buy, some will say, go to the pharmacy and just buy some antihistamines then, or a nose spray. And they're really underestimating the impact that that has on the person's quality of life. And teenagers and adults are equally significantly infected, you know, and I think as you get older, you start to really be aware of the fact that you keep clearing your throat and you're sniffing all the time. And that might impact on relationships or the way that you feel about yourself, because you know that you're constantly got a tissue and you're sneezing, and perhaps because you're clearing your throat, that affects your voice quality, meaning that you can't speak easily if you're a public speaker. So for adults as well, very similar symptoms, but they begin to really care about the way that's impacting on their sort of self-esteem. And some of the challenges for teenagers, teenagers particularly, is that they have very little control over their environment. And so do young people, to be honest. So when they're in the school environment, how clean is that school? Are they sitting on dusty mats, particularly those preschoolers and reception children that are told to sit on the floor? That actually can really affect their environmental allergies and their eczema particularly. But if those teenagers are off to university, can they, or are they like my son, will they keep their room as clean as they should? Will they do all the measures that we'll hear about that will help reduce house dust mite? And of course, if you don't do these things, they will impact on their ability to study, to get the grades that they should be achieving, to perform well, to attend work, and to function well in life. And for somebody listening who doesn't have those severe end of the symptoms, they'll be wondering what on earth I'm talking about. But I've had people come that have been mislabeled with chronic fatigue syndrome, sort of coming to me as a last resort of, is it allergies? And as soon as they start talking, I'm thinking to myself, this is barned or obvious this person has terrible allergies that no one has attempted to control at all. And it will always stick in my mind a younger child who was about 7, who was very active, loved dancing, and her parents noticed a complete change to her persona. Didn't attend dance classes, came home from school constantly asleep. And the story was so obviously house dust mite allergy. And when we put in the measures to treat that, we didn't even do immunotherapy to desensitize. We just put in all the basic measures to treat it. They wrote to me like, she is a different person. I can't believe it. And for me, I was so frustrated that something so simple had been overlooked by so many health professionals, because people will go and see all sorts of people, neurologists, respiratory doctors, ENT, general peds, all sorts of people, and nobody's just spotted that the problem is allergies that are poorly controlled. Obviously, that's the severe end of the spectrum, but there are a significant proportion out there of people living like that. And this table is from the British Society of Allergy and Clinical Immunology, which is essentially just summarising what I've said, that, you know, across all age groups, the commonest thing is the sniffing, the itching, congestion. For some also then the ear infections, the sort of pain in the ear, recurrent ear infections. And yes, more unusual to have the coughing, but still relatively common, I would say, particularly in the preschool age group. If you have symptoms that are only one-sided, or generally if you start having nosebleeds, bloody discharge, pain, complete loss of smell or change to your vision, then I really start to worry that there is another potentially more sinister cause here, particularly in an older person. And these people should be referred urgently to the ear, nose and throat doctors to make sure that we've ruled anything else out. You will have a slight reduction in your smell when you have really bad congestion, but you don't get complete loss. And yes, when you've got allergies, there's a bit of discomfort, but pain is not a huge feature. And the allergic rhinitis classification does separate these into mild, moderate and severe, and intermittent or persistent. So intermittent if you have symptoms for less than 4 days, a week for less than 4 weeks, whereas persistent is the other end. For me, the most obvious thing is if you start telling me that this is affecting schooling, studying, sleep, work, you're already going into the severe category. Usually by the time you've presented to a doctor, you're already in the moderate to severe, because most people just pop to the chemist and get some antihistamine. So I don't really need to do this. I just like, what's the impact on your life? Where have you been for treatments? And the fact that you're here tells me you're already in the moderate to severe spectrum. One of the things that we know is it can also really have an impact on asthma. And we know that sadly there are far too many asthma deaths, particularly in the UK, every day. And when there are reports about the asthma deaths, because they're always looked into, it is always noted that people have not had their environmental allergies assessed or controlled. And the reality is most people with asthma will have some rhinitis, whereas when you have rhinitis, a proportion of them will have asthma. So for instance, I have rhinitis, but I don't have asthma, but my son has asthma and rhinitis. And if you don't control here, your lungs will not be controlled. So one of the first things I do when I see someone with bad asthma is I look at, do you have environmental allergies? Have we controlled your upper airways? And in doing that, you will invariably get better control of their asthma. We've already talked about this, the impact on your quality of life. It affects your life dramatically. It will affect your working ability, your schooling ability, sleep. You'll want to take part in social activities because you're too tired. If it impacts on your asthma, then that can be life-threatening. And some people get recurrent sinusitis, so infections and inflammation in the sinuses, which causes pain. So when to refer onwards be for anybody who is not responding to what we would say maximal treatment. So for us, that is a regular nasal spray, a good one, using it properly, which I'm sure someone will go into shortly, and antihistamines. And then the NICE guidelines say refer on at that point if that's not getting better. As soon as somebody as a GP is starting to say, I'm missing school or work, that's telling me this is quite significant. And so I would expect most GPs to be thinking maybe they need to refer on at that point. Those red flag symptoms are going to the ear, nose and throat doctors. If somebody's looked at the nose and there's a lot of structural abnormality, then it might be that they need ear, nose and throat doctors to do some surgery first, to mean that when we're using those nasal sprays, they're actually going to be able to apply them into the nose. And so we work very closely with the ENT, and I've actually got quite a lot of training in that area, which helps me manage allergies. Or if you really don't know what the diagnosis is, then they need to be seeing somebody, either ENT or allergy. And when you should be assessed for immunotherapy, so that desensitization therapy is if you have basically those things. So you're on a regular nasal spray, antihistamines, and it is affecting your quality of life, and we've proven you're allergic, then a specialist should be looking at should you have immunotherapy to alter the course of the disease. Hope that's helpful. You can follow if you're on Instagram. I am at Dr. Helen Allergy. I'm also on Facebook. You'll be able to find all of those groups if you have a look at my website, drhelenallergy.co.uk. Thank you.
So, hello, my name's Catherine Sutton, and I want to talk to you today about house dust mites. So, I'm a mum in an allergic and asthmatic family. And out of my two children, one has diagnosed allergies, and the other probably has allergies too, but has never had any serious issues because I've taken steps to avoid house dust mites and other allergens that they were allergic to and also were in the air. My nephew was seriously ill because of house dust mite allergen. And also my father had a chronic cough until the age of about 80, at which stage we used the measures that I'm going to describe, and the chronic cough stopped. So I can actually, I've got a dust mite allergy as well, although I've never been tested, but it's quite clear because I can tell the difference in the air between a room that's had the indoor air quality sort of improved and one that isn't. Or if I was sleeping in a bed, then I'd know whether there was a dust mite cover on the bed. So I'm the founder of Airborne Allergy Action, and I've been raising awareness about the effects of these allergens and pollutants and viruses in indoor air because of my experiences. And I'm also the secretary of the Ella Roberta Family Foundation, which was set up in memory of Ella Kissy Deborah, who was the only person in the world to have air pollution put on her death certificate for asthma. We believe that clean air is a human right and that no child should die from asthma. So I want to talk to you today about house dust mites, but you need to look at it in the context of what else is going on in the air. So either allergenic or not allergenic, it doesn't really matter, because even reducing exposure to house dust mites improves effects for people who don't have house dust mite allergy as well. But you need to look at it in the context of what's in settled dust as well, which isn't the same as dust mites. So dust mites are in the bed, but settled dust, there's this source of pollutants, which is various particles from the outdoors as well as indoors. And it includes dust mites, it includes pests and pet allergens, cats and dogs, mold, semi-volatile organic compounds from cooking, pesticides, flame retardants, and even food allergenic particles like peanuts. So it's really important to get rid of the dust as well as the dust mites. and not being exposed to these. Also, people will be allergic to specific types of tree pollen. So you might have silver birch trees outside your house, and in April that could be a problem, or hazel and alder, and grass pollen in May to July, or mold spores in the air in July to September. So I want to tell you my story, which will give you a good indication of how important it is to avoid dust mites and other pollutants in the air. So when my child was 1, they started to cough, and they would get repeated coughs, and they couldn't stop coughing. So we went to the doctor, who gave us an inhaler and multiple sets of antibiotics. And we were a few times in A&E, once with a reduced oxygen level after a particular trip to the centre of London. And they would be well for a while, and then they'd start coughing again. And they had temperatures and nasty mucus and coughing and wheezing and allergic reactions and hives. But I just didn't understand why it was happening, because I'm quite a healthy person, and I didn't see why my child should be particularly ill. But at the age of about 5, in 2008, I saw them in their bedroom sneezing in a weird allergic way. And it was like, achoo, achoo, achoo. And I thought, you don't have asthma, you've got an allergy. So we went to the GP, but the GP was quite dismissive. And he was like, oh, I'm the doctor. I decide on who gets referrals. This won't get us very far. But I was so convinced that they had an allergy that I just sat there and insisted, basically. And sure enough, when we got to the referral, the allergies existed, and the blood test came back, and my child was off the scale allergic to house dust mite allergen, an allergen I'd never even heard of. Also had significant allergies to grass pollen, to cat and dog dander. Subsequently, we also found out that they were allergic to mold spores, which came off a real Christmas tree, which we brought into the house at Christmas, and they nearly had an anaphylactic shock. That was interesting that didn't come up on the allergy test. But what I didn't realize at the time was that these were very typical allergies for children with asthma and allergic rhinitis and food allergies. So the pediatrician gave me correct advice at that meeting. They gave me some Allergy UK leaflets, which said I should use anti-dust mite bedding. And the leaflets also mentioned a HEPA filter in my vacuum cleaner. And I looked at my vacuum cleaner, and it was actually the one that had a HEPA filter, but I hadn't realized what the filters meant. So I hadn't really been doing anything about it. And it was a bagged mealy. So the bag was separate was one that you just disposed of. So you never came into contact with the dust. So the same week on television, there was a documentary talking about this sort of thing. And Allergy UK were involved, and it explained the importance of understanding house dust mite and multi-factor reduction. And it all seemed to make perfect sense. So in the September of that year, so this was after the pollen season, no pollen around, I set about it, and the cough suddenly and very quickly stopped. So what we did was put anti-dust mite covers on all the beds, and I put the HEPA filter into the vacuum cleaner. And also I cleaned up and did a lot of wet, damp dusting, and it stopped. So over the next few years, my child would be generally okay, but then we'd go on holiday and the cough would start again, and we'd end up back at the nurse on steroids. And then I started to notice and find things out. So when was the grass pollen season as opposed to the tree pollen season? Because they would get asthma in the grass pollen season. And I started to notice what vacuum cleaners they were using in hotels when we went away. So I started taking my own bedding and vacuum cleaner to the hotels if they didn't have one that might be working. And suddenly we were not ending up back at the nurse. And as they got bigger, they got less reactive to things like perfumes in barber shops and cleaning products and chemicals. And they didn't get asthma from running around or from the cold. And the number of colds reduced. So we weren't no longer getting like viruses every month. We were getting them maybe once a year, which seemed a bit more sensible. So everything was fine until they went to secondary school. And day one, the cough started up again. And I didn't know where it was coming from. And it was quite scary because I thought we were definitely going to end up in A&E. So the only thing I could think of, the journey to school was on a train and they walked up the hill through a polluted town. So the only thing I could think of to change was to ask for a new vacuum cleaner for the block. And the headmaster immediately agreed. And as soon as they started to use it, the cough immediately stopped. So this was the moment the penny really dropped. I started asking other people about this, because up until this point, I didn't quite know why I seemed to have I seemed to know more than other people about it. But anyway, a friend of a friend's daughter was in hospital and she couldn't take her exams because of her asthma. She said her daughter had had a positive test for dust mites when she was 2, but no one had mentioned it in the whole time of being in hospital. They only gave out medication. So she made similar changes to her house and the school changed its vacuum cleaner and her child's asthma massively improved. And now that child is signed off all medication by her doctor. So after this, we started looking things up and finding things out. And we found out that research showed actually that anti-dust mite bedding reduced hospitalizations in dust mite allergic children. And that if you had allergen sensitivity and allergens present and a virus present, hospitalization was 20 times more likely. And that multi-allergen individualized approaches reduced asthma in children. But the British Asthma Guideline at that stage was saying allergen avoidance and dust mite avoidance should not be recommended for asthma. So no one was even asking the cause. And most parents were only being told to get their child to take the medication to control the asthma. So obviously you need to take your medication, but if you don't remove the cause of an illness, how are you going to get better? However, since the second inquest of Ella Deborah, which showed air pollution as a cause of death, NHS England put in place the National Asthma Bundle, providing individualised plans for children with asthma, so parents could do something about it in terms of reducing exposure to outdoor and indoor air pollution. And it makes these conversations about indoor and outdoor air pollution deliverable conversations. So since then, there have been multiple guidelines on house dust mites, but not all clinicians may be up to date. So you need to be aware of what clinicians might say about this. Previously, as I say, doctors weren't supposed to recommend house dust mite avoidance, but that evidence was marked as not suitable for use by clinicians as it was flawed. So since then, you've got the NICE guidelines on indoor air quality, which talk about house dust mites. You've got the Royal College of Paediatrics report on health effects of indoor air on children and young people, which also talk about inhaled allergens and of using anti-dust mite bedding and reducing exposure to cats and dogs and other allergens in the house. And you've got the new NICE guidelines on chronic asthma, which actually use house dust mite as a test for asthma. Also recently, there was the 2024 Child Mortality Database report on asthma and anaphylaxis. And this related to deaths from child asthma and anaphylaxis between 2019 and 2023. There were 54 deaths due to asthma. And it linked allergies and poor indoor air quality, including house dust mites and pets, cats and dogs. And this affects food allergy. So uncontrolled asthma is a major risk factor for a very bad outcome from anaphylaxis. So keeping house dust mites in check is very important for that. So as I mentioned before, there's this NHS National Asthma Bundle, and in it, it actually goes through what nurses should be looking for in terms of if they're in a house and they're looking to see whether house dust mite measures have been undertaken. So they might be looking at the bunk bed. So it's best to sleep at the top, because at the bottom, your child's going to be inhaling dust mites. They're looking for mattress cover. Has it got a mattress cover? Because the mattress is packed with dust mites. So you're going to be inhaling their their poo, which is the allergen. And if you put a cover on, then actually the mites die under the cover. So similarly for pillow protection, but you can also wash linen at 60 degrees, or and also damp dusting to remove any dust, which will have a big effect as well. Also, what kind of flooring you've got, whether you've got carpets, and whether you're actually using this HEPA vacuum cleaner, but that should actually be a vacuum cleaner where you actually never come into contact with the dust, because evidence has shown that some vacuum cleaners are releasing and resuspending the dust. So I've set about and put some key reduction methods for house dust mites in the slides. So I would advise you to start in the bedroom, and it's going to be an ongoing process. It's not as hard as it seems, because it's not everything you have to do on day one, but if you just keep going with it and you keep decluttering and you keep removing the dust, and if you get some good anti-dust mite bedding, or you wash your bedding every week at 60 degrees, and if you get a vacuum cleaner that doesn't resuspend dust, you can tell, because if a lot of the ones quite a lot of them do resuspend dust, but some are labeled as allergy friendly. They have this disposable bag and a HEPA filter as well. So I would avoid the ones that you empty yourself, because that's going to spill out dust or spin dust around, or these new stick-like ones which cost a lot of money, but actually aren't suitable for cleaning the whole house. So can you taste dust? Can you smell it? Are you sneezing when you're vacuuming? That kind of shows that the vacuum cleaner is releasing particles, and potentially if you've got a child on the floor, that can have a big effect on that child. Also, it's not good enough to just have wooden flooring, which some people think it is, because actually what happens is the dust gathers on the floor. So research in schools has shown that you can have twice as much large particle, PM2.5, which gathers on the floor than when it's carpeted. So, it's important to pay attention to the kind of vacuum cleaner you're using. So wet dust, and also getting rid of the dust behind the blinds, whether the blinds facing the window. If you've got Venetian blinds, that can be, they can really harbor a lot of dust. Look at the lampshades, look behind the radiators, and cuddly toys, they're packed with dust mites too. So put those away in a toy container, or put them in a freezer if they're ones that are regularly used. And get up at the top, on the top of cupboards and on the back of surfaces. Potentially you could move stuff onto a tray and then really clean the surfaces, because loads of dust collects at the back of shelves and things. So also you need to be aware that multiple fabric sofas can be a big issue. If you've got one fabric sofa, that might be fine, but if you've got a few, then that can have a real effect. I upgraded from a fabric one to a leather effect one, and I found there was a big difference in that. Get your humidity right, because dust mites thrive when it's moist, damp, moist, warm air. So humidity should be between 40 and 60 degrees. So using a dehumidifier, not a humidifier, not pumping water into the air, and open the window. And then, take notice of what other triggers may be around as well. Are there perfumes and MDF, which, like little children, they'll be reacting to those things too. So chemical sprays and things. So really take a whole holistic approach to what's going on. Take particular note if you're undergoing building work, and because that can be real trouble, especially when you're preparing for a baby. So it's not really a great idea to do building work when you've got a newborn baby. But if so, make sure you've got all the mitigations in place, and maybe use an asthma diary alongside your medication. So the problem could be at school. in fact, or the problem might be both at school and at home. So watch out for the Ask About Asthma campaign in September. This campaign is to do with week 38, where there's a spike in asthma, where the virus, the children come back to school, they all have a cold virus, or they all get a cold virus, and they all pass it around. And this makes gives an asthma spike, because if you have a virus plus an allergen, you're 20 times more likely to be hospitalized. So it increases the risk. And then you have health issues with the school. When you have absence problems, then you get bother with the school. So in September, if your child's at school, or this could apply to work as well, check out the vacuum cleaner. Is it a basic Henry, or is it a high filtration pneumatic? Because these are common in schools, these models. And they should have a few high filtration models, not just basic Henrys, which are going to release dust. And you could write to your headmaster for a new one. If you email me, I can send you a template for that with some backup evidence on why it might be needed. So I would suggest you spring clean your house before your child goes back to school, and then try to keep it as clean as possible through the winter, because by the time November comes, the dust will really be kicking in, and the dust mites will really be kicking in. And it will probably be a real problem by then. So you might also want to get a high clean air delivery rate HEPA air purifier, but I would avoid one with ionizers, which aren't very, very good. So yeah, the 2025 Asthma Friendly Schools Guidance, the National Child Mortality Database report, recommends that all schools should adopt these guidance, and that will put in asthma policy and asthma training, as well as highlighting all of these triggers in schools: dust mites, viruses, damp, mold. And it also highlights about vacuum cleaners and general indoor and outdoor air quality. A few tips about the holidays. If you're traveling in cars for a long journey, then the car can be an issue if it's not clean enough. So I would suggest you vacuum it out before you start. Also start looking at hotel vacuum cleaners and beddings. Many hotel groups know about these issues, and they actually use them for their branding. So for example, Premier Inn has a good night's sleep. Basically, they're just using high filtration SIBOs, and they're using anti-dust mite bedding. When you're there, put away any excess cushions and monitor how your child is reacting. So they may be rubbing their nose, which is an early sign of problems, because that's the allergic rhinitis before possible asthma. Also, fleeces and tops can trap dust, and that can trigger problems as well. And if you do these things, then you're likely to see an improvement in things like hay fever. As the hay fever season comes round, you probably won't get as bad hay fever or other allergy symptoms, because it's just basically one big bucket of allergens and pollutants. And as you reduce that, you will see a difference. So healthcare professionals should now be up to date with this, and you need to ignore any half-hearted clinicians who come out with these phrases, which I've heard 1,000 times. Oh, it's all too expensive. Well, actually, no, children shouldn't be lying in beds full of dust mites without their parents knowing about it. And we should have vacuum cleaners that actually work and actually keep the dust in. And so probably we need regulations about that. And then they say, oh, bedding doesn't work. Well, actually, yes, it does work. It's just that something else is triggering the problem, whether it be asthma or it's another illness. It could be a fabric headboard. It could be a huge sofa, or it could be the vacuum cleaner you're using. It's all too much effort. Well, it's not really too much effort, to be honest, if you go about it in the right way. And if you are having problems, just send me an email and I'll give you some free advice and point you in the right direction. And then they say, oh, just use the medication or just have immunotherapy. The medication and immunotherapy are not a substitute for clean air and reduction of pollutants, including house dust mites. Recently, 2025 Royal College of Physicians report linked indoor and outdoor air pollution to 700 other illnesses. Total cost in 2019 was estimated to be £27 billion. That's a massive effect and cost to the NHS. And they estimated 30,000 deaths in 2025. So to round off, I've just put some relevant research in there if you're interested, which showed that when you adopt these methods of multi-allergen avoidance, including house dust mite avoidance, in the right way, then you can really improve children's health, whether it's by asthma or it's other illnesses. And the cost savings also in this Alameda County study, they showed massive cost savings. So I'll just leave you with my contact details if you want to get in touch. We're at airborneallergyaction.org, and there's my email address, catherine.sutton@airborneallergyaction.org. And if you follow us on Facebook or on Instagram, and as I say, if you're having problems, send me an email and I will do what I can to help you. Thanks very much.
Hi, good evening. My name's Dr. Gary Steef. I'm a paediatric allergy consultant at University Hospitals of Leicester, but also a trustee for Allergy UK and also the chair of the Health Advisory Board. So it's a pleasure to be asked to talk about this. And so I'm going to talk about diagnosis and treatment options in relation to house dust mite. So I'll just briefly introduce the topic, and then I'm really going to focus on allergic rhinitis in children, focusing on house dust mite. So HDM stands for house dust mite. And then I also think it's really important to think about eczema as well, to consider, is house dust mite an important allergen there? Now, the reason I've shown this slide over here is more because I want you to look at rhinoconjunctivitis. So that's the medical term for having sort of nose symptoms and eye symptoms due to allergy. And what you can clearly see in this study of following a group of children from a Danish group, that allergic rhinitis is really uncommon in children sort of less than 2 years of age. And equally at 5 years of age, it's not particularly common. But as children get older, so up to when they're 10 and then grow older, it actually increases significantly. And the other thing you can see is as you get older, it increases, but actually very few outgrow it. So you can see that checkered box at the bottom, that's people who outgrow it. So very few people outgrow it and therefore continue to have symptoms long term. Now, the other thing to recognize is not everyone with rhinitis symptoms has got allergic rhinitis. So right at the top there, you can see from preschool children, we're saying it's not that common, but gets more increasingly common with as you get into your teenage years. But equally, there can be non-allergic rhinitis and also rhinitis due to infection, which is not due to allergy. Now, I quite like this slide, not the top bit, but the bottom bit, because when you look at certain guidelines looking at rhinitis, what they really consider is the impact on quality of life. And that's what I see every day in my practice. Actually, it does impact on a lot of people's lives, but not everyone. So it can be very mild, just having a slightly runny nose, but normal sleep, normal daily activities, and not really bothering children or adults at work or school, and not really problematic symptoms. So in those groups, you're less worried about it, and maybe it's less important to treat it, and therefore you can treat it if it's causing, if it's bothering your child. But then you've got the moderate to severe group where it impairs your sleep, impairs daily activity, and stops you from doing things. And that group, it's really important to treat it, and to treat it properly, because it can affect school performance and even exam grades if not treated properly. So now moving on to the crux of it. So how do you diagnose allergic rhinitis? And with anything in medicine, we always talk about the key thing is that story or that history. So when I'm taking a history, I'm wanting to know, do you have a runny or itchy nose? Is there sneezing? Is the nose blocked? Do you have itchy eyes? Sometimes a tickly throat and itchy ears. And then really important to try and associate with the time of year. So is it all year round? And that's when you're really thinking about possibly house dust mite and generally getting worse in the winter. Or is it just in the springtime, which will be tree pollen? Or if it's in the summer, so from middle of May till sort of end of July, August, then it's going to be grass pollen. And that really tells you and can help you. And that will vary from country to country. So I'm very much talking about the UK population. But equally in the history, it's important to consider, for instance, when I work in Leicester, we've got a high Asian community, and a lot of members go back to see family in holidays. And often it's important to ask that history, because if you could go back and you've got allergic rhinitis to house dust mite, for instance, and you went back to India to see family, for instance, and that got much better, and when you came back, it's much worse. Well, that suggests that house dust mite might be a trigger. Or if you went skiing in the Alps, where you're very high, actually house dust mite do not live there, and therefore you might get a significant improvement in symptoms. So I might share a few cases with you just to try and illustrate the point. So a 6-year-old boy who sneezes, a constant blocked nose. He's rubbing his nose and rubbing, often would be doing that all the time. So he might have a line across his nose as well. Happens all year and generally worse in the winter. And when I look in his nose, and it's really important to look in the nose, I can see that it's swollen in his nose, and we call that the inferior turbinate looks swollen, and there's quite a few clear secretions that you can see. So the question here is, should we do allergy tests? So in this situation, clearly you have a story of symptoms of allergic rhinitis, and then on top of that, you have an idea that this might be house dust mite is affecting the child all year round and generally worse in the winter. Now, I don't think it's essential to do allergy tests, but if you came to see me in my allergy clinic, of course, I've got the ability to do them, and therefore I think it's useful to do it. But I don't think it would be wrong to consider that may well be allergic rhinitis due to house dust mite, and therefore consider treating that situation. I suppose your GPs will have access probably to a blood test, but that can be quite invasive and not something you want. But equally, if you came to see me, I would certainly be doing allergy tests and skin testing as well. So I commonly do the most common allergens in the UK, which is house dust mite, grass, and then birch. And you can tell it's a valid test because your positive control is positive and your negative control is negative. So you use histamine for the positive control and you use saline for the negative control. So that's salt water, and they should be positive and negative. And then you can see house dust mite is clearly positive at 7 millimeters, and grass is also positive. However, in the case of this child does not have any symptoms or worsening in the summer. And therefore, in my mind, to me, the most important allergen is house dust mite because it's affecting all year round, worse in winter. Now, the fact the test is higher doesn't mean it's more severe. So what are my first line treatments? So commonly we use non-sedating, so non-drowsy antihistamines. And the commonest ones I use in my practice would be cetirizine, but there are other ones such as loratadine. And for older children, now you can also use fexofenadine. And that just gives you an idea of dosing of what you can do and what I do use. And you can see in the brackets there, I will actually even go to higher doses. It's normally extremely safe. And with cetirizine, very few people get drowsy, so it's normally very safe. If you were to get drowsy with cetirizine, which is uncommon, then I would try an alternative such as loratadine. But what I wouldn't be using here is chlorphenamine or Piriton, because that can make you drowsy and also affect school performance. So please remember that. It's really important not to use a drowsy antihistamine. And then you can see as well, the other treatment that I'd want to use is considering intranasal steroids. So antihistamines are very good for runny and itchy nose symptoms and have a very good evidence base for that. What they're not so good at is blocked nose symptoms. And that's where intranasal steroids come in, because they're very, very good for blocked nose symptoms as well as runny and itchy. And both antihistamines and intranasal steroids complement each other extremely well. And they're extremely safe, which I'll talk about in the next slide. However, they need to be prescribed and can't be bought over the counter. And that's not really about safety, but it's just about the current licensing and about it. So if you were prescribing from a doctor using the British National Formulary, that's the medicine book that doctors use, actually you have fluticasone is actually licensed from 4 to 11 years of age. So sorry, can be used from 4 to 11 years of age, and also mometasone from 3 to 11 years of age. So you can use it from as young as 3 years of age, according to its license. And these are the two which are the safest ones to use, and the ones I recommend. But often the one I tend to use most is Avamys, because it plays like a mist, and often it's very well tolerated by children. Now, the reason I've shown this slide is because very much to reassure you. So this looks at different steroids and their systemic absorption, so the absorption to the body. Now, nasal steroids very much work locally. And as you can see, the far end on the right, you've got fluticasone and mometasone, and that talks about how much is potentially absorbed systemically. And you can see tiny amounts are absorbed systemically, and therefore they're extremely safe and have minimal side effects. So that is the reason why I use fluticasone and mometasone rather than things like Becanase or Rhinocort, because actually much more absorbed by the body. Even those are very, very safe, but actually these ones are the safest ones. And if you're looking at your child, those are the ones I'd go for. And in fact, my son uses the Avamys. So let's go to case 2. A 6-year-old boy sneezes, constant blocked nose, rubbing his nose, and it's runny all year round and generally worse in winter. Possibly recently gets a spike in the summer term with itchy eyes as well, and he has similar symptoms. So I've presented pretty much the same case and shown exactly the same results, because in this situation, the history does support potentially grasping allergen, and therefore that's significant. So just having a blood test does not mean a definite diagnosis. In this case, the fact that they're positive and the story suggests it means he is certainly allergic to house mite and grass, whereas that first case, probably just house mite. And as far as grass is concerned, all it tells me is he has a risk of developing hay fever, and that's all. So I think with allergy tests, one thing you really need to know is that a positive test, i.e. sensitization, does not equal allergy. You only have diagnosis of allergy when you have both a positive test and you have symptoms. That's a really important concept in all allergy across the field. So what you can't just do is get allergy tests say it's positive and means you're allergic. That's whether it's air allergens or food allergens as well. And the other thing is size does matter. So often people think the bigger the size, the more severe it is. And that's certainly not the case. The bigger the size, the more likely you are to be allergic. And that again stands true for food. So again, please don't interpret that bigger means it's worse. So just to go back to that case 1, so what did we end up doing? So I wanted to try and get control quite quickly. So I used Avamys nasal spray twice a day for 2 or 3 weeks, and then reduced down to once a day. And I used cetirizine 5 milligrams twice a day. And with that, he was extremely well controlled and didn't have any further problems. Now, it's really important to know how to use a nose spray, and this is the BSACI sort of QR code to show you how to use a nose spray. Other resources also involve Allergy UK, have got resources as well, but equally there are resources from the website Itchy, Sneezy, Wheezy. So lots of resources, but often people don't use it correctly, and that could be a reason why it's not being effective. So that's really important. Now, going back to case 1, actually 2 years later, he was re-referred to us. His symptoms have deteriorated and weren't controlled now. And so how do I approach that? Well, the first thing I do is actually go over the history. Are they actually taking their medication, and are they using it the correct dose? Do we need to maximize that? Do you have the correct nasal spray technique? Are they using it, or do they not like it? And if I've ruled those things out, and despite, I suppose, maximal medical therapy, or at least decent amounts of medical therapy, then I'll consider something called immunotherapy. So what immunotherapy is giving yourself the allergen that you're allergic to in a small dose in order to change the way your immune system reacts. And by doing that, there's a clear immunological mechanism which actually blocks the effects of things like house mite or grass, and it changes the way your immune system responds. So therefore you become more tolerant to it. And studies show anything from a 30 to 40% improvement in symptoms by using that. And sometimes people get significantly better improvement, and often they can reduce their other medications. But most importantly, it's what we call a disease-modifying drug, and that actually it modifies the disease. So after using that treatment once a day for 3 years, if it's done by sublingual, that's underneath the tongue, then for years to come, you'll have benefits from that. And now there's emerging evidence in adults and some in children that by doing that, there could be an impact on maybe improving asthma control, and maybe even potentially preventing that. So there's more research needed there, but it's certainly important to be aware of what's happening. So that's really exciting. It's been around for a long time. And what you need to know is now immunotherapy for house dust mite has been is now licensed, and you can use it from 12 years of age. So it's been NICE approved, which is a great addition this year. On top of that, we also use immunotherapy for grass and for tree pollen. And I would say in my practice in the NHS, if I have a child who's got bad allergic rhinitis, I do use immunotherapy for things like house mite in children less than 12 years of age. Now, the reason I'm showing this study is really it's a UK-based study by Peter Arkwright and his team, and that's in the Northwest, is because I wanted to just show you real-life experience of doing immunotherapy. I think on I don't want to be too complicated, but on the left-hand side, HDM talks about house dust mite sublingual immunotherapy, then pollen in the middle, sublingual, that's underneath the tongue, and then on the far right, you've got pollen, that's by injection immunotherapy. And the majority of what we do these days is sublingual because it's very well tolerated, and therefore you don't need to come back and forth to hospital. So focusing on that left-hand side, those who had immunotherapy to house dust mite, there are a few that don't tolerate it because you can get symptoms on the way. You can cause symptoms of itchy mouth, tummy ache, which can last for quite a few weeks, but often with support of an allergy nurse, you can actually, that can help significantly, and you can take medicines to try and help. And most people can tolerate it. So in our experience, I don't think the dropout rate is as high as that in my experience. And then you had some patients with ongoing treatment and some who had completed their treatment. And again, this is not meant to be a complicated slide, but just to see the house dust mite group is that dotted, I suppose the dotted line, I'm not sure if you can see that, but the bottom line here. So that's more that line there. And what you can see at the top is just showing that there's a significant improvement in quality of life, essentially. So it does certainly improve quality of life. And therefore that is sustained, and these people really benefit from treatment. So I think what my take-home message is don't ignore rhinitis. It potentially can impact on quality of life, whether it's grass, tree, or even house dust mite. And I think house dust mite is less known about. I think you need to be aware that treatment can be really safe and effective. And the majority of people, you can get control using antihistamines and intranasal steroids. And know that those are really safe to use and can be really, really effective. And then in the group where despite that they still have problems, then there certainly is an increasing role of using immunotherapy to house dust mite. And as I said, NICE, that's the National Institute of Clinical Excellence, have approved it from 12 years of age. But we do use it in younger children, and it's same with grass and tree pollen. And then the last thing just to be aware of is that there is asthma and rhinitis are totally interlinked. We talk about one airway concept. If you treat one well, then it improves the other. So it's really important to treat rhinitis really well. It often will improve your asthma symptoms. And I mentioned about the link, by maybe using immunotherapy, that might modify, number one, the disease for rhinitis, but equally it might improve asthma. So that's something to consider, but more research is going to be coming out in the future, and I'm sure it will show positive benefits. So moving swiftly onto eczema, is house dust mite an important allergen? I think I just want to mention this because I think I'm really passionate about this. I want you to understand about this too. I think the key thing is people often worry that with eczema, there's something causing it. And underlying, you've got an impairment in your skin barrier with eczema. So the genetic component, and therefore it's impossible to get rid of eczema completely. It's a chronic disease and there is no specific cause, but sometimes allergen and sometimes irritants can make eczema worse, and weather changes if you're unwell, but often there's a fundamentally genetic component to it, which is the reason you have eczema. And it's very rare that something is causing it. And the biggest problem with eczema is under-treatment. And that's really important to be recognized. So therefore, you really need to get proper treatment. If you have moderate to severe eczema, then I need to think about two questions. Could an allergen be driving or contributing to the eczema? That could be food or house dust mite. And the thing I think about is that in the story, if you mention that thing I explained to you, so if generally your eczema is worse in winter, and let's say the family went to India or the Alps and it got much better, when you came back got much worse, that suggests that housefly might be a play here. Or if they also got allergic rhinitis as well, or the eczema is predominantly around the eyes, on the face and neck, in those exposed areas. And then you have to think about, if you've got bad eczema, you have a risk of an immediate food allergy, especially in that young child group. So if you have a child who's had eczema which was mild at 3 to 4 years of age, and now has got severe eczema at 13 or 14, well, that's not going to be food driving the eczema. So the top red line talks about uncontrolled eczema. It's often up and down, and you can't get control of it. And like those points, those arrows there, and the blues just talk about if you did an intervention there and it got worse or got better, you can't really see the wood from the trees. And therefore, you might think removing food gets better, but it depends on where you do that. So what you're trying to do is that green line to get eczema much more stable. And that's by proper treatment. So the first thing is using lots of moisturizer. And I would recommend the Allergy UK resources on this, as well as the Itchy Sneezy Wheezy website. Large amounts of moisturizer and applying them properly. Appropriate use of fingertip units for medicated creams like steroids. Again, they're extremely safe to use in the right way, and international, national, local islands all recommend them in the right way. So please don't be worried about using it. Steroids are very good at controlling inflammation. And then you can drop down to be what's called a proactive approach, so using it like twice a week to maintain control. But by using lots of moisturizer, you can reduce the steroid burden. And then the other thing that one can do is there are now much more steroid-sparing medications called topical calcineurin inhibitors. And again, there's really good information on Allergy UK, and also the National Eczema Society leaflet on TCIs can be really helpful. And so pimecrolimus can be very helpful. It's licensed from 3 months of age, but often we also use Protopic as a way of reducing the burden of steroids. So very safe. If you read about things, you might see some worrying things, but please know that they're extremely safe. They've been used by millions of people and extremely safe. There have been, if you look at in the internet search, you might say it can cause skin cancer, but there actually hasn't been any reported cases. It's extremely safe. So have a read of the leaflets and information on that. So this just talks about safety. So originally, that there's quite good evidence saying that there's no increased risk of cancer, and this is in latest guidelines from 2023, the American Academy. So very much to reassure you, I use it all the time. It can be very effective. Your GP might not be confident to use it, but actually it's not wrong to then try to pursue that by trying to go to dermatology to get that as a means of reducing steroid burden if you want to not use that. So just very quickly, I know I'm going over time, but a child who had moderate to severe eczema, they started on systemic medications, and they're using very potent steroids. They wanted to know whether allergy was an issue. And they were worried about food driving the eczema. So the eczema started at 2 to 3 years of age, and it's been a big problem for the last 2 to 3 years. So I know it's not food allergy. It improves when they went to India and deteriorates on the return. They've got blocked nose and they've got allergic rhinitis, having a big impact on their quality of life. So then very different. So 11-year-old boy, eczema at 1 year of life, last 2 years a significant problem, and prior to this was using Cetraban and occasional hydrocortisone, and currently stepped up, but you can see it improved when they went to India. Has a blocked nose, runny nose in the winter, and no history of immediate reactions. So would I test it? If I saw them, I would test them, but it's not essential. But I just want to illustrate that allergy is not a simple yes no answer, and the history hopefully gives you information that actually the story gives you that information. Just to say, I use the analogy of an alarm for allergy tests. So allergy tests like a bad car alarm. So ideally you want a good car alarm which only goes off when a burglar attacks your car. So allergy tests do that. They also go off when a cat jumps in the car, there's a strong wind. So hence it's a bad car alarm. So you can get positive tests and not be allergic. So I think the whole point of talking about eczema as well was to think about that it can impact on quality of life, but the biggest problem is not treating it properly. So really consider your patient quality of life and consider your children. The biggest problem with rhinitis and eczema is under treatment, and utilize the medications available to you. They can be very safe and very effective. I think that brings to the end of the talk, so I'm sorry for running over, but I hope it's been helpful and look forward to taking any questions. Thank you.
I think you'll agree with me, they were excellent presentations, and I hope you've learned quite a lot about house dust mite allergy, house dust mite management within the home, treatments for house dust mites, things that you can do to make life a lot more bearable with the house dust mite. And if that doesn't happen, where you might go and how you might get a referral and what types of things might be available to you. So we're going to move on to some questions now that we've got coming in. So you'll see from Slido, there might be some questions on here. So one of the questions is, I've always tested positive on skin prick testing for dust, but outgrew symptoms. Should I still take the same measures to remove mites? So I'm going to actually ask one of our guest speakers, Dr. Helen Howes, on that question. Helen, have you got an answer for us?
I knew you were coming to me. I mean, I think simple measures of removing house dust mite, like making sure that, you're cleaning adequately and damp dusting, are measures that perhaps all of us should take. And I don't know if anyone else in the family is affected. I guess if you no longer have symptoms, it's how intensive you want to be in that, if it doesn't affect your day-to-day life, the reality is you're probably not going to be thinking about it too much. There's a question of why maybe have you joined this webinar? Is it for someone else in the family if you no longer have any symptoms of it? So I think we'll naturally make adaptations as to whether things bother us. For instance, I have house dust mite allergy, but it's not really the thing that massively affects me. Mine is more grass pollen. So I'm going to make lots of measures to change for grass pollen day to day. I've still got anti-allergy bedding. I clean. Beyond that, I don't overly focus on it for myself, but I do for my son. So I think we'll make our own choices. I wouldn't be overly worried.
Thank you very much, Helen. Next question is, how concerned should I be regarding the link to causing asthma? How likely is it, and can I prevent it? So, Gary, I'm going to come to you for that question, please.
So, I mean, I have to say, in pediatrics, there is sort of some data now, and there's going to be studies to try and see whether if you were to have house dust mite immunotherapy, could that potentially prevent asthma. So I think we will know more in the next few years. I think there's also emerging data. So there's certainly adult data from Germany, which looks at a cohort of quite a lot of patients who've had immunotherapy, both grass and house dust mite. And if they have asthma, there's evidence to suggest that it improves their asthma over time and reduces their disease burden. That's done by quite big studies. Those studies have been done in children as well, but the data isn't as strong. But I think there will be data soon coming out, and potentially could having like immunotherapy, if you've got bad rhinitis, prevent asthma. Again, there will be probably data which comes out to support that. So I think the reason I'm just saying it's not totally clear cut is because I think more work needs to be done there. But I think it's, I think at this moment in time, you would not be having your immunotherapy or treatment to prevent asthma, but there may be data in the future. I suppose apart from immunotherapy, what is the evidence? I think clearly when you look at respiratory doctors, and I'm an allergist, what they do for a assessment of asthma is they will look at patients to see whether they have a atopic profile, and they do IgE testing because that makes you more likely to have an atopic profile and therefore potentially more responsive to steroid medications rather than actually trying to diagnose house mite allergy. So I think in a sense, I don't think I can give you a clear answer on that, but certainly there is emerging data that we need to be taking house mites seriously. But I think at the moment, my practice in all aspects of sort of rhinitis treatment is to get good control of the rhinitis to improve quality of life, because it does impact on quality of life.
Lovely. Thank you, Gary. This one's coming to you again, Helen. Can you get swelling under your eyes from a dust mite allergy?
Yeah, I mean, you can with environmental allergies. And as I say, I'm a big grass pollen sufferer, and come and see me in the season if I'm not being compliant with my medication, and I will look quite swollen. And we certainly see these allergic shiners, so dark rings under their eyes. You can often spot the children when they come into clinic who have this full sort of allergic atopic profile. They might often come and see me about having a food allergy treatment, for instance, and I'm often thinking the thing we need to really help your child with right now is their environmental allergies, the way they're mouth breathing, struggling, congested. Sometimes I think when you're quite close to it, either you're a sufferer or you're in your own family, you don't see the impact it's having on that person, and someone objective coming in can go, look, they really clearly are struggling day to day with these allergies. But yeah, they definitely have some swelling around the eyes. They can wake up in the morning looking quite puffy as well.
Super. Thank you, Helen. This one's coming to you, Catherine. One of the questions is, what are the most impactful steps I can do within the home to reduce mites and or their reactions to my skin?
Well, I would think put the anti-dust mite bedding on, because the amount of time you're in your bed is considerable. So that, and then you need to look at your vacuum cleaner as well, I'd say, because basically I'd say the combination, I mean, it depends upon the situation, but essentially most people find that they can, if I told them about the anti-dust mite bedding and a vacuum cleaner that doesn't spit out dust or rearrange the dust, and you never come into contact with that dust, you'd probably notice the difference fairly quickly. So I would say those two. I mean, look at your bedroom, because if you're sleeping in your bedroom, so that's a long period of time. So things in your bedroom, and also those two things, but also the wet dusting, because that I would say once you've done that, then the dust on the surfaces is probably going to irritate your nose anyway, if there is dust on surfaces. I mean, I guess it's how sensitive you are as well. But that's what I would say.
Yeah. Sorry, Amina, just to say, the only thing I would say as well is also remember that it's great to do those measures, but also please don't be scared of medication. There are lots of safe medication that can be used in conjunction with that. So don't feel you have to do one measure and then not others. Combination is often a good way forward.
Yeah, I think that it's very important to say it's the management of those symptoms and what will work to reduce those symptoms. And so for some people, they might be able to get away with very low level type of actions like changing bedding and putting bedding on. For other people, they will still remain symptomatic, so they will need something to reduce those symptoms. And one of the things that Allergy UK does is a part of our website, we have got things that have gone through a process of being tested. So we have bedding and vacuum cleaners and all sorts of things on our website that might actually be helpful to you, that's already been tested to make sure that they remove things like pollens or house dust mite through a proper filtration vacuum cleaner, for instance, or they hold our allergy friendly products. So that's an important thing. You can always browse our website and look for things that might be helpful there. But as Dr. Gary Stiefel says, it's important to control those symptoms. So if you still remain symptomatic, you need to be going to your GP to have those types of discussion, and so that you can have a referral for maybe some advanced treatment, especially if it's having an impact on your quality of life and those symptoms might be affecting your chest and your throat. So the next question I'm going to aim to Gary again, please. So it's saying, our doctor won't carry out house dust mite. Now it says immunology, but I think that means immunotherapy, until his eczema is cleared up. But the allergy is making his skin flare. Is this what you would recommend?
So I mean, I say that if you're referring to immunotherapy, so there have been studies looking at immunotherapy for eczema, and there's not good evidence for using it for eczema. But if I see a patient who's got really bad allergic rhinitis due to house dust mite, despite sort of optical medical management, and there are probably, as I said, in Europe, lower thresholds, I will be offering immunotherapy. So it is possible that it could make the eczema a little bit worse, but equally it could improve it. I think the jury's out there, but I would also, in conjunction with that, manage the eczema. So my opinion would be, from a pediatric point of view, I would not be withholding immunotherapy in a patient with bad eczema. So that's not my approach. I don't think there's evidence that you should be doing that. So I think if you meet criteria for immunotherapy because you've got really bad rhinitis, then that should be offered to you.
Lovely, thank you. And another one I'm going to...
Can I add a comment, if that's okay? Obviously, it's always different what somebody would do on the NHS versus private. So you have to sort of bear that in mind. But I have had patients who come privately, and perhaps for their rhinitis or sometimes for their eczema, we do it, and have noticed like quite a big benefit to their eczema. There was a systematic review out last year about might it help people with eczema, and it did suggest that there was benefits for some. It's just a shame. I don't think there's enough evidence for the NHS to put this into place yet. You know, it's a bit like the asthma argument. Is there enough data for us to offer it? But it does benefit some, and it certainly shouldn't be withheld purely for that reason. Normally, as allergists and specialists, we would be looking at increasing their eczema management alongside then trying to offer their treatment for rhinitis if it's helpful. But I wouldn't withhold it.
Thank you, Helen. I'm going to come to you, Helen, for this question, please. So the question is, can dust mite allergy be the cause of a positive IgE of all over intense pruritus, but few respiratory issues?
It's a tricky one. I do have quite a lot of consultations where people come about intense itch in adults and children. And sometimes we see that they are positive for dust mite. And I have had a few where they've noticed benefit from putting in those house dust mite measures and using antihistamine. quite often their GPs will have tried first line some antihistamine for intense itch. And I think it's also really important to make sure other causes of intense itch are ruled out. So depending on the age of the person, is there any, what's their liver function, what's their iron level, other reasons why you might get itching. So yes, sometimes, but I'd be mindful that I've ruled everything else out first. It's not a classic symptom.
Super, thank you. And this was really just a comment from somebody, and whoever posted it, because it's come up anonymously, but whoever posted it, thank you for the post. And it just said, my daughter was sneezing every morning with a runny nose for months, no other symptoms. I changed her bedding to anti-dust mite and wet cleaned her room, and now it's all gone. That's really good feedback. Thank you very much. But what we think is that it's like having a toolkit, and not everyone will benefit from just one of the tools. So you have to have lots of different tools in this toolkit to find out what works best for you. And so some people will benefit from, as we said, the dust mite bedding, and other people might not. So when they get symptoms, it's important to know that you need to treat those symptoms, because as our doctors were saying, it's so important to treat the nose, because that will have an effect on the chest as well. And so we don't want asthma to go uncontrolled. This is why we're shining a spotlight on house dust mite, because many people find that they do get not just allergic rhinitis, but they can get tightness of chest as well. So this question is going to be aimed at Helen. Do inhaled respiratory and non-inhaled allergies sit under environmental allergies, please?
Yes, do inhaled respiratory. Yeah, so I would tend to call environmental allergies, grass pollen, tree pollen, dust mite, cat, dog, the things that are in our environment that trigger respiratory symptoms, congestion, sneezing, itching. Yes, I think that's what that means.
Yeah, I think that's lovely.
As opposed to, if they're wondering about food, we would there's the debate over is it airborne, and that depends on the food, but that I wouldn't class that as environmental allergies. We tend to refer to it as the pollens and dust mite, etc.
Yeah, thank you. Now this is a very interesting one. I'm going to aim it to Catherine, but it might be that both our doctors will have a viewpoint on this as well. Should I get rid of my daughter's carpet in her bedroom to help with dust mite allergy?
Well, you can do, but the thing is that some people think, and some clinicians say, oh, you should get rid of your carpet. But in fact, the dust actually gathers on the floor. So the big particles of dust, research has shown, can actually bounce off. And basically, so it doesn't really, sort out your asthma, because you've still got big particles of dust. This has been shown in schools that, so it's important to clear the dust. Doesn't matter what floor you've still got to clear that dust. So people think, oh, I've got a wooden floor, and that's, the end of the story, but it's not really the end of the story, because it can gather. I mean, I've been looking at some myself in my house, so I can see it. And so you need to realize that.
And
but I've got carpet in my house, and we've got extreme dust mite allergies. So it's not really the carpet. If you have a vacuum cleaner that takes away the dust mites and this very small particles, whatever, then carpet's fine. But it depends what you're using on it.
And I think the carpet is quite an expensive thing. So what you don't want to do is take up the carpet at great expense when there's other things that you can do.
No, I don't think the carpet is necessarily the issue.
Yeah.
No, but this is what the lady's wanting to know. Does she need to take up the carpet for her
she doesn't need
daughter's
to take up the
allergy?
carpet. I wouldn't say so. I had a very old carpet, but because I had the right vacuum cleaner, it sorted it out. And we had carpet in the bedrooms. It wasn't an issue.
At the same time, if her symptoms are not, if they're really severe and it's a problem, you're doing lots of things and you're struggling, it also depends on the family dynamics,
Well, it doesn't.
the situation, the medications you're on, how bad it is.
Yeah, I mean, the medication is fine. So you take your medication anyway, but it's in terms of the carpet. I'm pretty confident in saying it's an issue about the vacuum cleaner, whether the vacuum cleaner is taking it up or not. So yeah, take your medication, obviously, but if you want to, but you can't rely on the fact that you've got a wooden floor to solve it if you're not taking that dust away.
We've got wooden floors throughout the house because we just happened to be in a position where we were changing them. They certainly have made no difference to Ethan's allergies whatsoever. And like you say, there are other measures like, is it hoovered enough? Is it damp dusting? And he's at the severity where it's not enough. He needs more treatment.
It's not actually the hoovering enough. It's what vacuum cleaner you've got. So
Yes.
I don't have to hoover a lot, but because I've got the right one, then it sorts it out.
Yeah, but he's on immunotherapy because his severity is on, the high end of the spectrum. But what I'm saying is it's not, the carpet, like you say, is not the be all and end all. It's the full picture.
Yeah, and I think that's important to say. So I think don't get rid of the carpet yet. Whoever posted that question, don't get rid of the carpet yet. There's other measures you can do first. And you can try those first. But if you're still symptomatic, it may not be the carpet that is the issue, and it really does need to be controlled in a better way. So just think about all those things as well. This one's aimed at Gary. The person who posted it said, I may have missed this, so sorry if I did. Is it safe for intranasal steroids to be used for a prolonged time, e.g. for a year or two?
So 100%, yes. So sort of, as I said, the nasal steroids we like are fluticasone and mometasone. They've got the best safety profile. So the first thing to say is in children, you can't buy them over the counter. So you need to get them prescribed by your GP. But yes, they can be safely used long term. I think in general, what we might say is if it's house dust mite that's affecting you, it might be that in the summer months, you might be able to reduce your medication and have like a steroid holiday like for 1 or 2 weeks to see whether you need it over that time. But if symptoms come back, you can definitely use it, and you can use it for years. So, using it for 1 to 2 years would not worry me at all. We've got patients on it for several years. I suppose in time, the question will be is in Germany, for instance, they have a much lower threshold to starting immunotherapy in that situation. And in the future, it might be in the NHS, you have to lower the threshold. Was actually, should we be using immunotherapy earlier? But at the moment in the UK, the guidance for children as such is only if you're on maximal medical therapy do you offer it. But this is likely to change, I think, over time.
Super, thank you. And I think it's important to say that steroids are anti-inflammatory. So our doctor, Dr. Helen, showed us the inflammation that's in the nose. So the steroid that is applied to the nose, the nasal steroid, takes down that inflammation over time. So helping to reduce that ability, to help reduce the swelling, but increase the ability to breathe through those the nostrils. And so that's why it's so important to take nasal steroids if you've got inflammation and blocked nose. So it's all about that toolkit and making sure that all those symptoms are managed as best they can. So we got a question, likewise, what are the best pillows for house dust mite? We've got lots of information on our website where things have been tested, so you can have a look on our website for answers to that as well. And again, bedding material and things like that. So we've got a lot of information of that. Another one, sorry, Gary, I'm coming to you again for this.
No problem.
It's saying, do you ever recommend nebulized steroids? I saw a recent small study that looked promising from the SNOT 22 score.
So I'm not aware of that, so I don't know. I may have to go have a look, but no, in general, you know, for allergic rhinitis due to house mite or grass, I don't recommend nebulized steroids.
Yeah, it's not something I've ever come across as well, as in the management of allergic rhinitis, nebulized steroids. I've not heard of that one before.
I would think it's, you know, unless equally if you're using it just like a one-off, it's unlikely to be that successful, I think, because the nature of it, you want to use an anti-inflammatory drug regularly at a small dose to maintain that reduction in swelling. So just to remind people, if you look at the national guidelines, which is called the BSACI guidelines on rhinitis, the evidence is extremely good for safety and for effectiveness of using nasal steroids. And they're excellent for itchy, runny, and especially blocked nose symptoms, where antihistamines are very good for itchy, runny symptoms, but not so good for blocked nose symptoms. And you also might find that nasal steroids can also help with your eye symptoms as well. By treating your nose, will often help your eye symptoms.
And I think it's true to say with nasal steroids that they just really act in the local area of the nose. So not a lot of the steroid actually gets taken up by the rest of the body. So it's not like steroids that you would take by your mouth, oral steroids, which can cause problems if they're used in high dose or quite frequently. So by using the nasal steroids on a regular basis and controlling those symptoms is a much safer way to treat your allergic rhinitis. Would you agree with that, Gary?
100%. And I think the same concept is if you've got asthma, you're using a steroid inhaler and you're wanting to try and control your exacerbations, because if you get an exacerbation, you'll get an oral dose of steroid, which affects your whole body. So the same concept applies there. And then again, the same for eczema. You know, you want to maintain eczema control by using topical treatment. So by doing all these things, you're trying to, in a sense, control things in a safe and effective way.
And I've got another one. Sorry, Gary, I'm going to come to you again for this one. It's saying, can cetirizine be taken indefinitely as part of asthma control? This is an adult actually who's saying that. I currently take 10 milligrams twice per day, March to October.
So I'm a pediatric allergist. So in terms of, in theory, it's not a treatment for asthma, but I just wonder whether is the reason you're taking it from that time because you've got allergic rhinitis as well. And we talked about that one airway hypothesis. So it could be that if you're having some slight symptoms in your nose, that's affecting your airway as well. And maybe by taking antihistamine, you're helping. I'm just guessing. Helen probably sees adult patients as well, but that would be my thought process, that actually you might be treating your rhinitis, which is helping your asthma.
Super. And Helen, I'm coming to you for this. It's saying, my ear hasn't cleared since a flight last May. Could this be related to environmental allergies?
Yes, I think it probably depends on the age of the person we're talking about with ear stuff, in that, you know, the thoughts around recurrent ear infections, glue ear, maybe more of a younger child in association with something like house dust mite allergy. Usually I'd expect to see some rhinitis and congestion. If you have associated nose and eye symptoms, so the runny nose, the congestion, the itchy eyes, maybe, especially if you've got an allergic background, like, you know, eczema, food allergies, etc. If it's just one ear, I'd be more inclined to think this is something else. and it should definitely be examined and seen. And, if it's an adult, especially if you've got affected hearing, you might need an ENT referral first to make sure there's nothing else that we need to worry about going on. It's important to rule out other causes and not blame everything on allergy. A common cause is eustachian tube dysfunction. So the tube that connects your nose to your middle ear can get full of fluid instead of air. And so repeatedly doing the Valsalva maneuver, where you hold your nose and pop your ears 3 times a day, can be quite helpful. And so can a nasal steroid spray help with the ear. So that might be worth it, but it needs a review with your GP and maybe an ENT review before we blame allergy. So I need a bit more of the history, really. But
yeah, super. Thank you, Helen. And whoever posted this, thank you very much for reminding us. And they've said air filters work as well. So it's good for patients to know all the things in the toolbox so they can make decisions that are informed for their child. So thank you. Yes, there's lots of things in that toolbox that might be quite helpful, but the main thing is to make sure that those symptoms are well controlled. And it might be some of the environmental changes, bedding, vacuum cleaner, air filtration, air purifiers, etc., and then medication. And if you still have got symptoms, that's the time to really think, maybe I need a referral for immunotherapy. It really, really is important to control these symptoms. We can't impress on you. These little mites can cause a lot of problems, and problems over time as well. So the other thing is,
could I just say, sorry?
Yeah, sure.
Also, I mean, it's also important about, looking at it in the context of clean air. So indoor air quality, both indoors and out, because that is, that's a overriding thing as well, that basically the respiratory clinicians are supposed to be talking about this in every asthma conversation now as deliverables, the indoor air quality and the outdoor air quality. So looking at it in the context of that, not just mites, but, the whole thing, just popping that in.
Super, thank you, Catherine. This one's going to Helen. Can my GP prescribe immunotherapy, or does it need to be a specialist?
No, they can't as it currently stands. So it certainly needs to be initiated, i.e. started by a specialist unit. That's the way it is at the moment for, I know I'm a GP, but I've specialised in allergy. And I wouldn't be able to see you in my GP practice and start the immunotherapy. You'd have to go and see one of the specialists in hospital. They would do a full assessment of, have you fit the criteria? Is this safe for you, etc. Sometimes people have shared care protocols where the specialists have initiated it and the GPs may continue on the prescription, but they can't start it themselves, not as we currently stand.
Super. And another one, I'm going to come to you, Helen. This person's asked, do you need to get tested for allergy before implementing changes, i.e. better bedding or carpet removal, etc.?
I mean, no, not necessarily. I think, in the UK, we do have I often think it's quite easy from a history to work out whether someone has allergies or not, based on what you're describing. So you expect some element of nose and eye symptoms, often a personal history of allergy or atopy or a family history. You expect the symptoms to be both sided. If you were sort of, say, 80 and you've suddenly found that you've got no symptoms and you've never had allergies, I'm going to think something else might be going on for you. But, we can often quite tell from the history, and that's why GPs don't routinely test everybody, whether it's likely you have allergies or not. And therefore, if you think you or your child does, you can put those measures in. I mean, there's some cost associated with it, but there's no risk associated with better bedding and a good Hoover, etc. So if you think that house dust might affect you, by all means, make those changes. If you're keen to know, have they definitely got this allergy or not, have that open conversation with your GP and explain why you want the test, and they should be able to do it for you.
I think the testing for house dust mite is particularly important if you're going to go through a process such as immunotherapy.
Yeah.
So they would always do those type of testings in specialist centres before they start people on immunotherapy,
Yeah,
just
definitely.
to make sure that you're actually allergic to that allergen. You don't want to go, because immunotherapy is a 3-year course of treatment, and you don't want to go through that treatment if you've not actually got a not just the history, but a diagnostic test that actually will say, yes, that is something that might be driving these symptoms. So we've had such a fantastic session, and thank you so much to our guest speakers. I couldn't have asked for a better session on this. This was our first patient webinar, and I'd like to thank our sponsors for making this possible. And feedback is so important to us at Allergy UK, and we value it. And we listen to your voice. So we would like you to tell us what other things you might like to hear about and see on a webinar, so that help you understand allergy a bit better. Would it be maybe some live demonstrations on how to use a nasal spray, or how to use asthma inhalers, or how to use an adrenaline auto-injector if you've been prescribed one? So tell us what you think. Tell us what you think about this webinar. If you'd like to see some more, were the discussions helpful? Any feedback, whether it's good or you've got something that wasn't so good about it, tell us, because it will really help us understand what we'd like to, what we can do in the future. So thank you very much for joining us, and I wish you all a very good evening, and thank you once again to all our speakers. Bye-bye.
Bye.